Winning a battle against Ebola. But as the war goes on, where should the fight be concentrated? On experimental and expensive vaccines? Or can lessons be learned from Nigeria's success in containing the virus? This is Inside Story. Hello and welcome to the program. I'm Mike Hanna. Nigeria is being praised for containing the Ebola virus and from preventing it spreading in Africa's most populous nation. The underlying formula for success, taking immediate measures to contain the virus and raising public awareness. On the face of it, simple steps but effective ones. Running parallel to this is the race to roll out vaccines. The World Health Organization says it hopes to begin testing 2 experimental vaccines in West Africa by January, at this stage on thousands of frontline healthcare workers. The world's worst outbreak of Ebola has so far claimed the lives of more than 4,500 people. But with some health experts warning that there could be 10,000 new cases a week by the end of the year, turning the corner is becoming an ever more pressing priority. So, what can we learn from Nigeria? The first case in Nigeria was that of a Liberian man who collapsed when he arrived at Lagos Airport. In all, there were 19 confirmed cases and 7 deaths, a relatively small number compared to the deaths in neighbouring countries. It was largely due to a more advanced healthcare system. When the first case was confirmed, the government declared a national public health emergency and was able to reach every person who came into contact with the virus. The government also redirected many of the resources that were already in place to deal with diseases like polio and cholera. Well, let's bring in our guests. In Abuja, Abdulsalam Nasidi, Director of Nigeria's Centre for Disease Control. In London, Dr. Ian Jones, Professor of Virology at Reading University. And in Berlin, Florian Westphal, General Director of Doctors Without Borders in Germany. Welcome to you all. Well, let's begin with Florian Westphal. The head of the Red Cross, the Red Crescent, is quoted as saying that in order to deal with the virus, there has got to be good isolation, good treatment of the patients, good, dignified and safe burials. He says if this is done, then the virus can be contained. Now, it sounds quite a simple recipe, but it's deeply complicated on the ground, is it not?
Yes, indeed, that is a major challenge. First of all, to put patients, to get them into an isolated facility where they can then be treated by medical staff who are adequately protected. As you know, we don't have a drug yet to treat Ebola, but we can help patients to be stabilized. And the earlier they arrive in treatment, the better their chances are of success. I think it's always important to underline that people do survive Ebola. We've just had more than 1,000 people coming out of our treatment centers who have survived. So there is hope despite the desperate odds against the sick.
Dr. Ian Jones, we mentioned Nigeria's success. It has been declared Ebola-free after the necessary period. Was this because of the limited size of the outbreak in Nigeria, or the response, or indeed both?
It was largely the response, I think. We have to remember that the virus that was transported into Nigeria is exactly the same virus that was in West Africa. So there's no change in that, no change in the biological properties. What was different is that the country responded very quickly and put in measures to prevent contact between primary cases and further cases. They also traced all those individuals that probably did have contact with Mr. Sawyer and monitored them for the development of disease. These are classic contagion control measures. They do work. They've worked in every previous Ebola outbreak, and they clearly worked in Nigeria as well.
Well, Abdulsalam Nasidi, what do you think was the most critical part in containing the spread of the virus in Nigeria?
I think just as the previous speaker has mentioned, the speed of the response is so key, and starting from the political to technical level. First and foremost, for the country to admit that yes, the virus is here, and really, which means not going into denial. Then the second thing is to quickly put in place the technical team that will fight this virus. And what now became so important is the speed of the response. Everything that was done was to ensure that we are ahead of the virus. We didn't allow the virus to escape from the primary, secondary contacts into the community, into the rural areas where it would have been so difficult for us to control.
Well, Ian Jones, perhaps it's important to note that Nigeria had a system of very sophisticated polio response teams in place. So there are basic structures within the healthcare system that an outbreak of disease can be dealt with on an emergency basis. How important was this, the fact that there was already protocols established in terms of dealing with an outbreak of any disease, in terms of dealing with the threat of outbreak of this particular virus?
Yes, it was very important. I mean, the fact that existing resource could be redirected to this new problem was an important factor in following these cases and preventing further transmission. And of course, there's been a lot of comments about the fractured infrastructure in particularly Liberia, which prevents that from happening. And that certainly is one of the reasons why it continues to spread, particularly in rural communities which do not get access to healthcare teams.
Well, Florian Westphal, we heard there from Abdul Salam Nasidi, the government reaction was immediate. There was no denial. This as well are key aspects, are they not? The fact that governments themselves must engage and move into an immediate high gear to not only attempt to contain the virus, but also, importantly, to reassure the country's citizens.
Absolutely. I mean, governments are the main responsible for operating the health system in any country, usually. And governments can obviously also really create a sense of trust by the population in the healthcare system. Because understandably, the people of Liberia, Sierra Leone and Guinea, when they encountered this new and dreadful threat, which was totally unfamiliar in these countries, they were full of distrust towards people coming towards them in protective gear, claiming to be able to help them. And here government plays a key role, because government has to literally sensitize people, make them aware of what they can do to reduce the risk of further contagion, and if available, where they can take their sick relatives for treatment.
Well, Abdul Salam Nasidi, to look further into the Nigerian response, one of the decisions that was taken was not to close the country's borders in order to prevent any panic among the country's population. Now, these steps taken by the government, very, very immediate steps, were they part of a protocol that had been discussed, or was it a government actually reacting to events immediately and on the fly and essentially making it up as it went along?
Yeah, actually it was part of the protocol designed by what we call the Emergency Operations Center, the coordinating mechanism we established immediately in Lagos, to coordinate all our response activities. Additionally, the President of Nigeria also directed that we should not do anything that will stigmatize the countries affected, and we should also mobilize to assist those countries. So it would have been counterproductive if we had started closing our borders and denying access to these other countries. And so what we decided to do is to strengthen our point of entry control activities, introduces screening, body scannings, and also establishing a quarantine system that will have actually been used to isolate any suspected passenger entering into Nigeria.
Dr. Ian Jones, we made mention at the beginning of the show of the search into vaccines at this particular point, attempting to create vaccines for this particular strain of the virus. Now, this is a deeply difficult task, is it not, considering as well that it is understood that the virus is mutating fairly rapidly, as do many viruses of this type. So creating the vaccine is at best a stopgap measure, is it not?
In part, that's true. It is true that the virus changes regularly, but the tracking of the virus so far has shown that it doesn't seem to pick up a single signature. So there is no evidence that the virus is actually changing to something new. It's more or less a scattergun every time it replicates, and that scattergun is renewed at the next replication cycle. As far as vaccines are concerned, the vaccine has been in development for at least 10 years. It's just that the animal trials, which had been successful to date, were not able to say that this would be entirely safe if it were rolled out to man. And those are the trials that are now taking place, both in Europe and, as you stated, soon in West Africa.
If I may just follow up there, Dr. Jones, are we looking at the processes being fast-tracked because of the nature of the current outbreak?
Yes, we are. The trials have already started, some here in the UK, and major manufacturing facilities have already begun to gear up production so that there will be a number of shots available in the early part of next year. I think it's important to note, however, that this isn't a quick fix. Remember that you have to get to the people who are infected in order to vaccinate them. And so whilst it might be rolled out in the short term to healthcare workers, applying it more generally to the population is going to be quite tricky, and it is not a way to curtail this epidemic quickly. That remains contagion control for in the first instance.
Yes, Florian Westphal, I mean, you have your health workers on the front line. That is a key point, is it not? The vaccine, the development of the vaccine is not a complete hallelujah saving all in sight. It is just part of the process and probably would be used on the healthcare workers in the first place, is it not?
No, as important as it is in the medium to long term, I think what we're looking at now is really short-term immediate measures that can save lives and in the process prevent a further escalation of this epidemic in the 3 affected countries. Because every single time you manage to get somebody into an isolated facility and to treat them, first of all, as I said earlier, there is a chance of survival, albeit limited, but obviously it also means you somewhat reduce the risk for the population as a whole. The same goes for every safe burial that can be conducted, for every home protection kit that can be distributed to a family to at least provide some basic safety against infection. We really now have to focus on the immediate measures needed on the ground as a priority, while obviously promoting research into vaccines, trials. Also something that is going on the ground or will start soon is actually testing existing medicines in different combinations, including in MSF-run treatment centers, to see whether those may work.
Well, Abdul Salam Nasiri, we're talking about the high-tech end in terms of the vaccines, but Nigeria actually dealt with it in a very low-tech way on one level. Obviously, there is no cure. It is a question of treatment of the patients. And here, rehydration. This was a simple yet absolutely critical way of treating those who had contracted the disease, was it not? This whole issue of rehydration, providing lots and lots and lots of water to the patients, once again, was this something that had been planned for?
Yeah, you're absolutely right. We right from the beginning believe that you don't need rocket science to be able to address the issue of Ebola and treat the patients that are infected. But nevertheless, we believe strongly that vaccines, if available, will play key roles in interrupting the transmission of the virus, in the affected countries. So to me, as a virologist, I believe pursuance of development of effective vaccines will serve as a very important tool for interruption of transmission within the population that is now ravaged. Nevertheless, as you rightly said, we used in Nigeria the low tech, and as I said, you don't need to be a world power to be able to control Ebola. We use our low tech, but actually using existing public health structures like the National Public Health Institute, such as the Nigerian Center for Disease Control, having in place this rudimentary public health structures that we were using previously to fight other diseases, as you rightly said, like polio, cholera, meningitis, and use it and apply it immediately, and not really waiting for foreign aid. So with this type of rudimentary structures on the ground, you could do what you have to do to address and immediately contain the movement of the virus. As regards the treatment, you are absolutely right. All we did was to understand the pathogenic pathway of the virus, affecting the intestine and then the brain. So you have the enteropathic effect and the encephalopathic effect. So we addressed, what does the virus do to the gastrointestinal tract, and how do we really mitigate the impact of this virus, and then limit, the suffering of the patient. So we went very simple, by extensive rehydration, even getting the patients to orally rehydrate, and in case they can't, we do IVs. We had very well-trained doctors, nurses that were 24 hours around the patients, and the care and support was perfect. And then, of course, we use other drugs in case the virus escapes and start infecting the brain, addressing the issues of the encephalopathic effect of this virus. So, we are very happy that at least using this approach, we could increase the rate of survival of our patients, and many of our patients came out from the treatment isolation wards.
Well, we discussed the issue of vaccines, and a number of countries are developing these as well. But the World Health Organization is also working with partners to see if blood serum can be used to help those with the virus. The blood of Ebola survivors would be taken in the same way as it is normally donated. The important thing here is that their blood contains Ebola antibodies. Red and white blood cells and a number of other cells are then removed. The resulting serum would then be given to Ebola patients. The antibodies could help them fight off the virus. But donors would also need to be screened for other infections such as hepatitis and HIV, and hospitals would need to have the facilities and staff to produce, test and administer the blood products. In all short, all very complex and time-consuming. And even then, many hospitals at the moment are struggling to provide even basic supplies and personal protective gear. Well, Dr. Rian Jones, this issue of creating the serum, once again, just another avenue being explored, being attempted. But once again, we are looking at a process that is painstaking, requires certain health protocols already in place, and would actually have a limited impact in terms of large numbers of people contracting the virus. Is that the case?
Yes, it is the case. It's a relatively sensible thing to do, passive immunotherapy as it's called, the idea that the survivors from Ebola would effectively have been vaccinated by the natural infection and so would have immunity to the virus, and that immunity can be recovered from the plasma in their bloodstream and then used to give others immunity. The scientific literature is only about 50-50 on how effective that is, and as you've rightly pointed out, it is a complex procedure. A number of safety issues have to be covered, and also the final product has to be delivered by transfusion, which means that an individual has to be immobilized in an isolation suite. So it's not something that's going to roll out to the vast population at risk, but it is something that could offer some level of protection for the few that get infected and are in the right situation at the right time.
Well, Florian Westphal, we have made mention during the show of the importance of established health structures within the country. As it was said, Liberia, Guinea, Sierra Leone, all having been through natural and political disasters, health structures virtually non-existent in many areas. Now, in dealing with the current outbreak of Ebola, how important is it to begin putting those structures into place? Because even when this, and if this one is contained, there is going to be another one coming behind. The whole question of actually directing the primary issues, which is the lack of health infrastructure. Is this something that can be done while at the same time you're fighting the outbreak?
I think that's probably quite difficult to be realistic. Obviously, what we're trying to do is to ensure the highest quality care possible under the circumstances. And what we're trying to do also is, as Doctors Without Borders, is pass on this experience we have from decades of fighting different Ebola outbreaks to people on the ground. The majority of our staff in the 3 countries are obviously local people, including local medical staff. But you draw attention to a key point, which is that apart from the crisis around Ebola, we obviously have a broader crisis, which is around the health system as a whole, and which affects many sick people who currently don't feel able to access healthcare because structures are shut or because they're simply too scared, and who therefore, in all probability, actually die from a number of preventable causes. Imagine you have malaria right now in Sierra Leone. The initial symptoms, such as a high fever, are going to be very similar to those of Ebola. You're probably going to be extremely scared to seek any kind of assistance in a medical structure. So this is a big problem which also has to be addressed.
Well, Abdul Salam Nasidi, I mean, this is an important point. The Ebola outbreak is one thing. There are other diseases that can occur at any time. Within Nigeria, once again, the ever-presence of polio, as you said, of cholera, always there. It is critical, is it not, at this particular stage, even at the height of a massive outbreak, to keep an eye open on what else could be coming behind it or alongside it.
You're absolutely right, and this is the collateral effect of the Ebola outbreak, that often than not a concentration is all on the Ebola, but there could be other simultaneously occurring outbreaks, and often than not all the structures or infrastructures available are now diverted for the fight against Ebola. And I think, while addressing on the best approach to fight and control this outbreak, we should just think about immediate, medium-term, and then long-term strategies. And, in countries where you don't even have any significant infrastructure, where the bed occupancy or bed capacity is now less than 10% of what is required to just address the Ebola problem alone, I don't see how you can succeed if you don't simultaneously address how to increase their capacity and improve on this infrastructure. So you will have patients, being admitted on the streets or in their homes, and which means you don't have health facilities to get them. The next facilities or structures that are very key in addressing these issues is the institutions that will train and improve the performance of the healthcare workers. For instance, in Nigeria, we combined extensive training of the healthcare workers before allowing them to go near the patient. As a result, we did not have any healthcare worker that became contaminated with the virus outside those primary contacts that came with Patrick Sawyer, the Liberian who brought the infection into Nigeria. So this showed that side by side with any response activity, it is so important to have training facilities. Like we have what we call the Nigerian Field Epidemiological and Laboratory Training Program, and this is the team that we mobilize, to really be the foot soldiers in the forefront in fighting this outbreak. It worked effectively, and as a result, the first responders were safe. They knew what to do, and the last point on infrastructure. For instance, in Lagos, there was existing what we call the infectious disease hospital, which was almost virtually neglected, but the governor of this state rose to the call and quickly upgraded this facility, and within 2-3 weeks put in place isolation wards that could be used for the treatment of these patients. And lastly, we also had our MDR TB isolation facilities, which we also utilized very urgently and quickly, and upgraded a little bit, and then it improved our survival rate. So existing structures are so crucial in this fight, and leaving countries so weak without the international community coming to their rescue very quickly to address how to expand these infrastructures that are needed to fight the disease is really sad indeed.
Well, at that particular point, we come to an end of the show. My thanks to our guests, Abdul Salam Nasidi, Ian Jones, and Florian Westphal. And do please feel free to add your voice to this discussion. You can leave your comments at facebook.com/AJ Inside Story. We're also on Twitter. Look for @AJ Inside Story. I'm Mike Hanna. Thanks for watching, and goodbye for now.